Amy Lou Porter, one of the founding members. Thank you all for attending in person tonight. I feel like this is the biggest group we've had in person, and I'm very excited that you all are with us tonight. This is our 11th Power 100 Women event tonight. I want to share a quick update about us. If you haven't seen, we've been setting up at first Saturdays on the square. So we were there this past Saturday. We will be there next Saturday. So if anybody wants to come, you can stand at the booth with us and talk to people, or you can take some cards and walk around and hand them out to people. Anything you feel like you want to do, you know, while you're shop, you know, you can come and shop. Oh my gosh, I spend so much money every time we have it. Anyway, so we have collectively donated $54,762 as of tonight, or before tonight. And all of that benefits Lincoln County. As of today, we have 62 members and 6 teams. Our goal is 100 women. So please help us get the word out. The more members, the bigger impact we can make. So if we get 100 women or 100 individuals and teams, then our donation would be $10,000. So that's our ultimate goal, is to exceed that, because you know we're overachievers here. All right, so we'll start our presentations. Our 3 nonprofits presenting tonight are Junior's House, Quatina M. Wolaver Foundation of Hope, and Southern Alliance Spay and Neuter Clinic. Each will present for a maximum of 5 minutes with an additional 5 minutes for questions. Then all individual members and 1 person from each team will vote electronically or in person if you're here. The link for the vote has been emailed to members. We will open the vote link after all nonprofits have presented. We will give everyone about 5 minutes to vote, and we will then announce the winner. You will then make your check payable to the winner. We do ask that if you are not here in person, so if you are out watching us live, that you submit all donations by May 22nd. That's 2 weeks from today. And so now it is time for our presentations. So first up is Crystal with Junior's House, and Alan. Oops, a little slippery spot there. Come on up so they can see you. Are you gonna hide over here? Come over here and sit with me. We're not that close. You're not going that close. Sit down. Yeah, sit. There we go. All right, you're not looking at anyone. Alan's not making great eye contact. He knew we had a meeting. Hi, my name is Crystal Guest. I'm the Executive Director at Junior's House, and thank you all so much for having us back. I remember I was here back in November of 2020. I think it was your first meeting, and I think we were your first recipients, and I want to say thank you. We were so honored to be selected, and I'm honored to be in this room and with you guys. I know several of you in here. I've met most of you. Some of you serve on my board. And I just think it's a great thing that you guys are doing for Lincoln County and helping so many nonprofits. It's really, I appreciate it for me and for the other nonprofits that you guys have helped. So they sent us out some questions. I'm going to make sure I try to hit those all. So we are, anybody in here who's not heard of Junior's House? Okay, hi, welcome. We're good, I'm glad, that's exciting. So we are in Fayetteville, Tennessee. We opened our doors in 2003, so do you know what that means? Debbie's very excited. Debbie, what does that mean? It's our 20th.
It's our 20th year anniversary.
Yes. So October of this year is going to be our 20th year anniversary, and we're trying to plan something eventful for the community to say thank you for all you've done. So when we opened our doors in 2003, it's after Chief Joyce McConnell went out on a child abuse case on a 6-year-old little boy named Junior, who had been killed due to a child abuse. I think he lived out in Flintville. He was 6 years old. He hadn't started school when he interrupted his father's video game. And he was beaten to death, unfortunately. I did bring a few. If you haven't read the story, it's not a fun read. It's very, I still tear up when I read this story. His life passed away, and Joyce went home with this goal that his life would not be forgotten and that we would come together as a community and make sure that we offered a safer environment for the children that we served. So Joyce, with this leadership, Lincoln, opened our doors in 2003, and guys, 20 years, and we have grown phenomenally. And that's because of you. That's because of Lincoln County. I'm gonna say that Lincoln County
I always say, is the Mayberry of all of the communities we serve. We do serve 4 counties. This is our hometown. This is where we started, but we now are located in Bedford, Moore, and Marshall. We have buildings in Bedford and Marshall. Lincoln County is our primary facility. Those other facilities are part-time staffed with the people who come and go from there. So that's how we were created. Our mission is to provide free services to victims of child abuse in your community, and there's unfortunately a lot of them. Lincoln and Bedford run about even in how many kids that we serve, so a total about 500 children per year, with about 200 from here and about 200 from Bedford. Very few from Moore. Lynchburg's, I don't know what's going on up in Lynchburg, and then Marshall County is usually about 90 to 85 of those children, and so half of our time, half of what we do is definitely focused in Fayetteville. And like I said, that is our home county. That's where we were created. Junior's house, Junior's life was in Lincoln County. We provide a lot of free services. As I said, we started out with a director in a building, and now we have about 8 staff. And we also became the first center in Tennessee to also have what's called a CASA program, Court-Appointed Special Advocates. And so that added some volunteers with us. And so we're up to about, with our board members in CASA, we're about 45 volunteers, and we have 8 staff members now. And that means that we are serving over 550 cases of child abuse. We provided over 175 forensic interviews and over 500 free mental health sessions, and over 2,000 body safety kids were trained in body safety, and 1,000 or more of those are out of Lincoln County. So those are all programs that we're offering. We did lose about $60,000 in funding this past year due to grant revamping or the loss of VOCA coming out of the federal government. It wasn't just us, it was across the state, but we did lose a substantial amount. So when you choose us, your money pays for those free services. No family, we don't take insurance cards, we don't take anything. They come in, and everything we do is for free. Let's see, I'm trying to make sure I get everything. I know I've only got a minute left. Our funding, we do have some state grants. We do fundraise. Our big walk is coming up next week. Our Blue Ribbon Walk or this week. Oh boy, I better keep up with that. May 11th at the fairgrounds. Y'all be praying for good weather. And I think now I have to take questions. Going to move on to that. What questions do y'all have for me? Yes.
Tell us what Alan does.
So Alan is our facility dog. He's 7 years old. He also is from Florida, by the way. He was raised in Florida, but at a college university, and he gets to see the kids when they come in. He plays fetch, does shake. He does a lot of fetch. So like today, a little boy walked in, and he's like, Alan. And Alan, as soon as he said his name, Alan runs down the hallway to get his bear. And the boy's looking at me like, where did he go? I said, he's gone to get his bear. And he comes back for his bear, and he throws it. We've been to court when children are so emotionally distraught. The judge will ask us to come over, and I've sat in the hallway with children with Alan laying on their laps and just letting them pet him. He is the sweetest mannered dog. He's got this sad face, but he's happy, truly, I promise you. All he's thinking about is I have a couple of pieces of kibble in my hand. So if we have a second at the end, I'll show you. I'll see if I can get him to do a few things that he gets to do with the kids. Other questions?
For people who aren't aware of it, I've toured the facility when I went through Lincoln Leadership, and it was really great, really informative to know that when these kids have to testify, you might want to tell them about that, how you have the videotape, the room where they feel safe. And
so the Child Advocacy Center, the main thing was to create an environment where kids could come after something horrible has happened and have a safe, child-friendly environment. So from the time you walk into our lobby, there's toys, there's a dog, the bright colors, and we, by statute, which means the law book states that the only way that you can use a forensic interview, a videotape of a child being interviewed about child abuse in the court and use it admissible under a certain age, it has to be done by us. So if law enforcement does it, they can't use that video if they're under a certain age. It has to be a Child Advocacy Center, and so we have very well trained staff that spend lots of training every year, making sure that we ask these children in the most least traumatic, non-leading way about what has happened to them. And I'll tell you, I've been around the state, I know a lot, we have one of the best in this county, so she does a really good job. I can't tell you how many times I've been told this child is not going to talk, but she just has a way, and they get in there and they feel comfortable, and they tell their story. And so every day, we always say every day we get to meet our heroes, because these kids are amazing, even though they may have had something really horrible happen to them.
How many staff members do you have?
So I have about 8 staff right now, and I have a couple of part-time contractors who help with therapy.
Do these funds also pay for training for those staff members, or is that some of the contracted
So-
things that you're talking about, or?
So we
or
do-
they come to you already trained?
Oh no, so when we have new staff, and we've been fortunate, we do have a few new staff that have started this year, but historically, most of us have been there for a really long time. So the training that we've had that's, we need it, that's been paid for, has been paid for, but we do a little bit of our budget every year for training funds, but we're fortunate that a lot of times, like, there's certain conferences and stuff, and they may give us a couple of scholarships, so maybe 2 people go and they get to train in that way, or they try to offer the training free. Maybe somebody else can get a grant and they can offer that. Like right now, I need somebody to go through a training for our family advocate, so we've applied for a scholarship to see if we can get funding for that. But if they don't, then we will have to use that out of general funds.
So there's not very many instances where your employees will have to pay for things on their own?
No, ma'am. No, we try to make sure we cover the cost for that. We don't pay our employees a lot to do this kind of work, and so with any kind of like training expenses, we try to cover those for the most part. Now, if they want to do something additional and special that we can't afford, then they could do that, but it's not something we can always pay for. Yes, ma'am.
Is there something special you would do with this money if you were awarded this money this time?
So as I said, that $60,000 that we lost directly impacted the therapy services. So the kids that, it was the primary funding for our therapist here in Lincoln County. It was actually the entire funding for her. And so the money will go directly towards therapeutic services to be able to continue those for the kids free of charge. Other questions, guys? These are great questions.
What kind of requirements do you need for your staff?
So these, as far as they have to have a bachelor's degree in social work or something similar if they're gonna work with the children. Many of us have master's degrees. We have masters in social work. We've been able to add a Spanish-speaking employee this year, so we were excited about that. And we've really focused on making sure that we have people that are trained in different types of therapy that have been evidence-based. We really try to stick to evidence-based. So even this program that we're going out into the schools and using, we went ahead and switched this year to a program called the Monique Burr program, and that's because it was evidence-based to be more protective of children. So we really try to make sure that the services that we offer are of good quality and are actually helpful. Any other questions, guys? I may be out of town. I am. Well, I do have brochures. If you want to know more, come talk to me after. Oh, and one last thing really quick. Even if whatever happens here tonight, all of the nonprofits in this county are great, but I do want to say that we do have volunteer opportunities. We would love to have you as a cost of volunteer if you're interested in working hands-on with kids, and then we also have openings on our board at a certain time of the year, so we would love to have you if you're more interested in learning more about Junior's House, and I appreciate your time tonight. Thank you so much.
Thank you. Thank you. Next up is Summer with Quatina and Wolaver Foundation of Hope. Thank you. Hello, everybody. So, yep, like she said, my name is Summer Southern, and I'm with the Quatina and Wolaver Foundation of Hope. Quatina was my aunt. She passed away in 2017 of ovarian cancer. And we come from a family of women, so for none of us to be knowledgeable about that, I think is a terrible oversight. There's definitely a breakdown somewhere along the lines. So I and my family have kind of taken it upon ourselves. We started this nonprofit. It originally started with a scholarship at Riverside Christian Academy. So what we found out through Quatina's fight with this cancer was that there's not a test for it, 80% of women are diagnosed at stage 3 or 4. Because of that, because there's no test, your symptoms are really benign. I had information packets to pass out to you guys today, but my printer wanted to go on the fritz, of course, this afternoon. So in order to get that information out to the community, to the ladies like you, I do First Fridays and any kind of vendor events a lot of times, and we sell things to fundraise so we can fund our awareness goals. But what we do is we pass out information cards and things like that. We try to get out in the community because, like I said, it's my grandmother, my mom, 2 of her sisters, and all the girls had girls, and so for none of us to know anything about this is just, I know that means that a lot of other ladies in the community didn't too. So the way that we help is directly through our scholarship. We try to we establish that at RCA, so that's reaching out to our younger community. We've established that there because of Quatina's daughter was a student there when she was diagnosed. She's since graduated, moved on to college, is doing great, but she then was really young and at RCA, and so we put our scholarship there. And then we also spend a lot of money on research because, as I mentioned, there's not a test for this. So that's the way that a lot of our money that we raise through our events gets spent. And we also are able to support individual women who are fighting. A lot of these are local, and a lot of times we help ladies in North Alabama, Tennessee Valley, because fortunately this cancer it only affects about 1 in 78 women. So thankfully that doesn't seem like it's a whole lot, but many of you women in here, I know in September, have probably seen our display on the courthouse, and Reba Seals, Jean Quickstroke, Jennifer Taylor, Jennifer Berngruber, Quatina Wolaver, Marg Hall, Lois O'Neill, Tanya Monks Wilson, Janice Reniger, and Tina Metcalf are all ladies in Lincoln County that have been affected by ovarian cancer. And you probably, like Jennifer Berngruber, her mom owns a shop on the square. Like, you may not know that you're connected to this, but I guarantee you probably are in some way. But again, because it's not often diagnosed, which that's very thankful, because it's the deadliest gynecological cancer that there is, and it's the 5th leading cancer cause of death in women in the United States. So there's about 14,000, I think it's 21,000 diagnosed each year in the U.S., so it seems like it's a low number, but as those are just the 10 ladies that have reached out that allowed us to use their image and spread their story for awareness for our community. So, if that's the 10, I've been approached at countless events on that too, where women have come up to me and said they have ovarian cancer. They know somebody who does here in the county, but they don't always want their story and their image out there being used, for various reasons, but it doesn't get talked about a lot, and that's one of our biggest things. So we focus, like I said, our key tenets are the awareness feature here in Lincoln County. We have a small community, so that's really where I focus. I think we start here at home and then we grow it outwards. So we try to focus here. Almost all of our money stays here except for our research funds. We raise these through several events that we do throughout the year. Usually it's 5Ks and racing events and stuff like that, but I've made a joke, wrapping it up here, but made a joke that I think this is the 4th time we've actually presented, and this is actually the perfect platform for us to spread awareness. Like, you guys are the target audience, so I keep joking that I'm not winning because you guys need to keep hearing the message over and over. It takes to kind of pound it in that even if you don't have ovaries, even if you're up on your annual, you need to pay attention to this because it's for our family. My aunt was dead in about 100 days from diagnosis, so it can be really fast. So that's why, like I said, try to make light of it sometimes, but it is a very serious conversation. So I hope that you guys are paying attention, and that's my 5 minutes. So questions?
I have a question.
Sure.
Can you tell us some of the symptoms or some of the symptoms that Quat had?
Sure. Well, for Quat, her biggest one, I feel like, and my mom was here, she was her caretaker, so she may correct me on this, but I feel like for me, the weirdest or the one that was most obvious was just her eating a few bites and feeling really, really full. So that was one for her, but just generally speaking, they use an acronym. It's BEACH, so it's bloating, eating just a little bit and feeling super full, abdominal pain or just discomfort, And then there, any kind of changes in your bathroom habits, so like frequency of going to the restroom or any changes like that. And then heightened fatigue, which a lot of women deal with all the time anyway. And for her age, my aunt was 49, and so, for her, you get into menopause symptoms. You don't know what, you're going through changes and all that stuff. So she was in hospital after hospital. I mean, we went to the doctor, I can't even tell you how many times. She was misdiagnosed. They had her on anti-anxiety meds, told her she was stressed out because we're all just delicate flowers.
Yes.
If anything happens, we're just stressed. And so, they told her that, sent her home, it got worse, and physically had her on a table taking her gallbladder out, which was another misdiagnosis, and saw the tumor. That's how we finally got a diagnosis. And at that point, she had been having symptoms for over a year, probably, and they were textbook classic symptoms, because another one of hers was heightened fatigue. She was about my size. She was a size 6, small, and she had a cantaloupe growing in her that we couldn't tell, she couldn't tell, so it's just something to watch out for. And I always walk the line. I don't want to scaremonger, because the symptoms that you probably is an ovarian cancer, like I just told you, it's not diagnosed a tremendous amount, but it's just something that you want to eliminate that first, and then if it's not that, then figure out what it is that way. And that's what I wish we would have pushed, because if I would have seen one of these infographics that I see now 1,000 times, because the groups I'm in, I would have been like, you need to get checked for that, because she just checked all those boxes. So it's just that's why I say the awareness is the key. We got to let our ladies know, and gentlemen, that's the part that, I want to get like breast cancer in a lot of ways. You can't go through October, every NFL player and baseball player and all that stuff, and I'm like, they're doing it right. They have such a good awareness game going, and so that's what we would like to see here in Lincoln County. And we've started by lighting the courthouse up, and every year that I do that campaign, I get women contact us without fail about they went and got checked or they're getting checked. So it is working here. I will say that.
And so you think the monies that you might, if you won tonight, that you would use for marketing kind of things, and like for your to get some of
Primarily
this-
here, I think if I won tonight, so this money, because I fund my scholarship with our poker run event, and the individuals, when we support them, that's usually done on our Facebook fundraising platform. So almost all that money is given to those ladies, but it's given by their own personal friends and family. So that's kind of how we fund our individual donations. And then, so for this, it will be our administrators. I have no staff, no paid staff, $0 have ever been given to me or spent or anything. It's kind of been an army of one, and then my family of volunteers. So I have no overhead. I do everything out of my house. Every single dollar that gets donated goes to awareness. It goes to a care package that goes to a patient, things like that. It's all done for administrative right here in Lincoln County. Yep.
How can you be tested for it?
You can't. You have to get a piece cut out of you and sent off to a lab. You can do they can do a CA-125, which is a cancer antigen 125 is what that stands for. It's a blood draw. And that is only a very basic indicator. It can be elevated, it can be lowered. It's just a tool in a toolkit. So if you were to get a CA-125 and it was elevated, they may say, let's do a transvaginal ultrasound. Then they'll go in there, look around, and then if they see something that they're concerned with, then still to get an actual diagnosis, you actually have to go in there and get a biopsy. You have to get cut on. There's nothing else that will give you a definitive diagnosis.
So where are we in research?
We are so close on, there's so many institutions that are working on the test. Like there's a group that's working on being able to do this with your PAP, like existing tests, that are already there using it for a different purpose. And then there's so many colleges just working on blood tests, working on being able to test for all cancers with a drop of your blood. There's so many people working on the problem, but there hasn't been a breakthrough yet as far as getting a marketable test that we can use every year, just like your pap smear. And that's the goal. And then of course we'll have to fight insurance to pay for it. But at least if we can get it, to the market, that's a huge thing. So that's why I feel so passionate about the research.
Do you do anything for, say, people that can't afford to go get tested?
Well, we don't have any resources, like most of our thing, and again, since there is no test, we don't provide any medical funding. What I have been doing to patients recently is providing, another cancer patient told me that gift cards were extremely helpful for DoorDash. So we've been given $500 DoorDash
gift cards to patients and caregivers. She said when her family, like if she's tired, had a chemo week or something, then that makes it really easy for her to feed her kids and stuff. So I kind of try to talk to each patient and see what they need and where I can kind of fill it. And so that's what I've been doing the last couple of times. But it, to answer your question, no, we don't have any like medical funds set aside that we can pay medical bills right now.
So there's not a place where you can, somebody comes to you and says, I wanna get tested, I've had these symptoms. There's not a place that they can go to, like the health, you know, like a health department or anywhere where they can get free.
Not through us. There's only whatever resources are available through the public than that, and the stuff that we know about. So where I would direct them on that would be try to go to a health department to see if they would do that. Or the other thing that, kind of in the same vein, but not exactly, but Hudson Alpha, just right down here in Huntsville, Alabama, is a great resource, and they do genetic counseling and testing, and which I've had done there after my aunt got sick. So they are able, they usually do their program every year. It's called Information is Power, and they do genetic testing for BRCA1, BRCA2, and then they counsel you as to what those results mean and how you can deal that, and then they get resources. So mostly right now where I'm at, like I said, at one person, mostly I have to direct people to other resources that I know exist, and so I just try to keep up with stuff like that. If anybody, I hadn't had anybody reach out like that, but that's what I would do. I would just try to work my channel, because I know a lot of ladies down there, and see what I could do to help them.
Summer,
Yeah.
would you mind posting a link to that on
Sure.
our Facebook
Yep.
when you get a chance?
Yep, I sure will.
And anything else you want,
Okay.
information you want out?
Sure. All right. Thank you.
Thank you.
And next up is Bonnie with Southern Alliance Spay Neuter Clinic.
You can use the dog if you want.
Hi, sweetie. Hey, you. Do you want to go sit with me?
Well, everybody started clapping, so you got up and assumed it was for him.
Hi, I'm Bonnie Cowan. I'm from Southern Alliance Spay Neuter Clinic. We are located in Park City. We are offer assistance for spay and neuter of dogs and cats belonging to low-income families in Lincoln County. We started in 2006 as a spay neuter assistance program. 2013, we were able to open our own clinic with a veterinarian and staff. And in that 10 years that we were open, we spayed and neutered 21,000 dogs and cats in Lincoln County. A lot of those from the animal shelter here. We got those fixed before they got adopted out, which has made a huge, huge difference for them and for our county too. Pet overpopulation is just unreal here and everywhere. Especially cats. Cats can have 3 to 4 litters of kittens a year. They'll have up to 5, 6. We've seen some with as many as 8 kittens in one litter. Dogs, especially his size, you know, they'll have 8, 10, 12 puppies. If you can imagine those animals out there with families that, you know, they don't have the resources, the funds to have their pets spayed and neutered. For a dog at a regular clinic, it could cost anywhere from $300 to $500 just to have them spayed. I don't know many people, honestly, just regular people that can come up with that much money to have their animal fixed. Cats, it all depends on where you take them to. 100 plus to have a female cat spayed. A lot of times it's more than that because they're going to charge for a lot of things that they do need but don't absolutely have to have, you know, all those extra vaccines and stuff. One thing we do offer with every surgery is a rabies vaccine. Most of these animals in this county never get a rabies vaccine. We do get grants. Community Foundation of Middle Tennessee is one of our bigger grantors. Whenever I apply for that grant, I always ask for funding for rabies, parvo distemper vaccines, FBRCP vaccines for cats, all those extra things that these animals never get any other time in their lifetime until they come to us to be spayed and neutered. For most of our clients, we ask a copay of $10 for a cat and $20 for a dog. Occasionally, we do get funding where we can offer it for free. We do a lot of those copays just as a guarantee that those animals get to the clinic and get spayed and neutered. Right now, we do not have a veterinarian. We lost our veterinarian, spent almost 2 years ago. She took a job closer to home. Don't blame her. It was a long drive from where she lived at Owens Crossroads. Just never dreamed that it was going to be so hard to replace her. But we are still working on finding a vet so we can reopen our clinic. In the meantime, we are back to our spay neuter assistance program. So we have people that come to us, we get their voucher to them, and they can have their animals spayed in Huntsville at North Alabama Spay Neuter Clinic, or they can have them spayed in Shelbyville at Middle Tennessee Spay Neuter Clinic. We still offer those vaccines included with that voucher. And like I said, it costs them $10 for a cat and $20 for a dog. Just in our voucher program for the last 2 years, we have managed to spay and neuter about 500 animals for Lincoln County, which actually for that kind of program is quite a few animals. The way we figure how many animals are saved or not born is the multiple is 5. So the 21,000 that we spayed in 10 years, we're talking about 100,000 animals that aren't born to reproduce. So that really cuts down on the pet or population. We do have a fundraiser coming up June 2nd. It is going to be another salads luncheon. It has always went over really well. We have a lot of really good cooks in our community. We have a lot of people that donate food, salads, all kinds of salads, not just green salads, but everything, just amazing food and desserts. And it's just a good place to come and sit down and eat and enjoy each other. It's going to be at St. Mary Magdalene from 11 to 1, so please come. That's on a Friday. We would love to have you all there. And I think that's about it. So if anybody has any questions.
I have a quick question.
Sure.
For the fundraiser, do y'all do to go?
We do to go. So you don't have to come in and sit down to eat. You can come in and make a plate, take it back with you. There's a lot of people that work around the courthouse or around the square. They come in, they get their plates and take them back to work to eat. So they have a good lunch. And the way this works too is it's called a silver bowl event. We don't have a certain price that we charge anybody. You come in, you make a donation, just drop your money in that silver bowl and go get your food and enjoy yourself. So, any other questions? Yes, ma'am.
Why has it been so difficult to find another vet to come to this clinic?
It's there is a tremendous veterinarian shortage. It's not just for the spay neuter clinics. It's also for other veterinarian clinics. I think when COVID happened, a lot of the older vets retired. The younger vets took over those positions, and not as many are graduating from veterinarian school that they did before. So it's really created a huge shortage.
Is there no way you could get some sort of coalition of vets in the community and have them do like so many a week or?
You mean like our regular veterinarian clinics?
Yes.
Actually, they are so busy doing their own work, and a lot of them are hurting trying to find relief veterinarians for them, or just part-time vets to help them out with their own businesses. And also during COVID, there was a lot of animals that were adopted. So that has created a huge business for the veterinarians, the existing veterinarians too, to take care of those animals. So that's one reason that everybody is having a really tough time finding an employee right now. Okay, all right, thank you.
Thank y'all so much for taking your time to speak with us today, and letting us know how all of you assist our community and our neighbors and our friends. But now it is time to vote. So each of our members received an email with the link to cast their vote. You have 5 minutes to submit your vote. If you have any questions, let us know, and we will announce the winner shortly. If you're in person and you want a paper ballot, we have those. I'll bring you some. Does it say accepting Deborah was gonna get us. All right, ladies, the vote is in. Anybody want to do it like a drum roll? There we go. All right. So please share the mission of each of these organizations with your friends, your families, your coworkers, so that we can continue to support all of these organizations. Tonight's winner is Quatina and Wolaver Foundation of Hope. Please remember to make checks payable too. Is that how they should make it out?
If y'all wanna leave them blank, I'll write them. I do it all the time, cause it is a mouthful. It is, so if y'all wanna leave them blank, or yes, that's.
Okay. Quatina M. Wolaver Foundation of Hope. And here we will collect your donations, but if you are live, watch us later on Facebook, mail your donations by May 22nd, that's 2 weeks, and you'll mail it to Power of 100, P.O. Box 1450, Fayetteville, Tennessee. Thank you all so much for spending time with us. Remember to visit power100womenlc.com to become a member and register for our next event, which will be August 14th. Thank y'all so much.
Also, if you guys, and some of the Power of 100 or 100 Women Who Care, they nominate the 501c3, but if y'all know of 501c3s that are needing help, please send them our way, or give me or Amy Lou a call, and we'll call them and tell them what we're about and try to help those groups.
Yes. Thank y'all.